episode 2 of Ask Club 360, where we're answering all your questions related to health, fitness, pain, rehabilitation, and nutrition. So this week's question comes from Jake, and Jake asks, what is sciatica and what is the best treatment for it? So there's actually quite a lot to unpack in this question. No doubt most of you watching will have heard of the term sciatica, will have had family members and friends who may have experienced this condition, and you may have experienced it yourself. Now, sciatica isn't really a term that we use that often these days in the medical world. It's not an actual condition itself, it's more an umbrella term for a number of different conditions which may refer pain from other parts of the body, in particular the lower back, into the leg. Now, these different conditions need to be treated very differently. And so if we prescribe generic treatments for sciatica, they, for the most part, will be largely ineffective. The first of these conditions is what we call neuropathic pain with central sensitivity. Now, basically all musculoskeletal pain will have different degrees of correlation with the amount of pain and the amount of tissue damage that someone has. In central sensitization, we believe that there's a very poor correlation and that we experience a lot more pain than the actual physical impairments or the what we call nociception, so the actual tissue damage, would indicate. So basically the central nervous system becomes very sensitized, and we basically get much better at producing pain. We identify these conditions with a number of questionnaires and also through a thorough evaluation, especially of a person's subjective presentation, their history. And with these sort of conditions, typical manual therapy approaches, mobilization, manipulation, and many of the exercise approaches that we may apply to other forms of back-related leg pain will not be effective here. These conditions usually require, especially in the early stages, education and followed by a very graded degree of movement and pain exposure. So it's important that we do identify these because these are the more serious conditions and the more likely to become chronic. The second type of condition we have is called neuropathic pain with a compressive neuropathy. So in this case, we do actually have a direct compression on a nerve, which is changing the mechanical conduction or the neural conduction. These presentations are usually associated with what we refer to as negative symptoms. So things like numbness and weakness, and so we assess these things. We assess someone's sensation, their muscle strength, comparing side to side, and also the reflexes. And so if we find that these conditions are impaired, along with a typical pattern of pain, so these presentations tend to be worse with things like walking, long duration standing, where the spine is in a position where it may provide compression on the nerve, then we need to treat these conditions with exercises and manual therapy that's aimed to open that space and to provide some decrease in the amount of compression. The third category is what we call peripheral nerve sensitization. So instead of the nerve being directly compressed, we actually get some inflammation around the area of the nerve. So say if we have an acute disc injury where we get inflammation, that inflammation can then cause the nerve to be inflamed. And these type of presentations will be worse with positions or movements where the nerve is on stretch. So you can imagine lying on your back and bringing the leg up. Instead of feeling a normal stretching sensation in the back of the thigh, we'll feel more of a nervy sensation, and that movement will be quite restricted. These type of conditions, as long as the inflammation in the area settles down, the inflammation in the nerve will often dissipate after somewhere between 4 to 8 weeks. So part of that treatment is obviously addressing the original cause. If that's a lower back issue, sometimes these can come on secondary to hamstring strains because the sciatic nerve actually travels through the back of the thigh and through the hamstrings. So we actually want to treat the source of that inflammation. But then things like neural mobilization, so exercises that some of you may have done, sliders and gliders and neural glides and things like that, if applied in the right sort of dosage, can be quite effective for this sort of condition, but they will be ineffective and potentially make things worse if applied to those other categories. The final category that we see is actually the most common is referred pain. So we may have an issue in the lower back to do with a disc or a facet joint or a muscle, some sort of musculoskeletal structure that's providing input back to the brain, saying that there's stress in this area, that area is under an excessive amount of load. And the brain, instead of reading that signal as coming from the lower back, it's essentially a mapping error where the brain perceives that signal as coming from the leg, and because of that will distribute pain into the leg. However, things like neural stretching, so putting that nerve on stretch, things like conduction, so your strength and sensation and reflex tests will be largely negative. So no, we're not seeing actual direct nerve involvement, but we are seeing pain in the back of the leg that's originating in the back. So with these conditions, we want to treat the source. So we may do exercises focused on decreasing the load around that area, and perhaps some manual therapy directed at decreasing the specific sensitivity in that area, which in turn should decrease that amount of lower back pain. So, and lower back and leg pain. So if you do have pain in the back of the leg that doesn't seem to be attributed to a specific cause, an acute injury to the hamstrings or an overuse injury in that area, then it is important that you do see a medical professional, so that they can undergo a full, you can undergo a full examination and determine what is actually causing that pain, and so that you can then go ahead with the appropriate treatment plan. So thanks again for your question, Jake, and we look forward to answering more of your questions on the next episode of Ask Club 360. Thanks for watching.